Oh, sorry. Okay. Hi, Miss Mom. I'm Megan. I'll be working with you today.
Hi, Megan.
So do you prefer to be called Miss Mom or on? Okay, on. Well, I was looking at your chart, and it seems like you're having some pain symptoms and some popping and clicking. So can you tell me more about that?
I have popping on this side of my face, the left side. I've had my jaw block in the past.
Really?
But I've been able to, get it back into place.
Okay.
I guess I have headaches every once in a while too.
Okay. So you said that it locks sometimes. Is there anything that you do to kind of help it get back into place?
I'm just able to kind of maneuver it back, and it's usually okay. So it's not too bad.
Okay. So how long have you been experiencing the pain on the left side?
I've always had the popping for as long as I can remember, but I never had pain associated with it until I started dental school.
Oh, okay. Okay, so how far along are you in dental school now?
I started school in 2008, so about 2 years.
Okay, all right. So, that's probably a pretty stressful lifestyle.
Yeah, I would say that.
Okay, all right. So if I were to say on a scale from 1 to 10, how intense is the pain?
I don't know. I think my pain threshold is not very high, and I don't like pain at all, so I would say it's an 8.
Oh, okay.
Because, what other thing do I have to compare it to, really? So,
yeah, so I guess if 1 was nothing and 10 is the worst possible, we're going to call it an 8. Okay. Yeah. Is it always an 8, or sometimes it's a little less, a little more?
I would say that it's worse in the mornings.
Okay.
It gets better, with movement, I guess, but it's usually worse when I wake up.
Okay, that makes sense. Do you ever find yourself clenching or grinding?
I'm not quite sure, actually. I think I do. I mean, I know that when I go to bed or when I sleep, my sleep isn't very sound. I find myself waking up, I'm still tired in the morning, basically, and I'm not really sure why. Okay,
well, that could definitely be something to do with the pain you're having or just the lifestyle that you're living. I'm sure you're up really late studying. So, is there anything that you do that makes the pain better or worse?
I think heat, usually a heating pad typically makes it feel better. I know that when I work out or during yoga, it helps a lot. And plus yoga is in a heated room, so I think that helps. And then also, what else was I gonna say? What makes it worse when I chew I really like crunchy things like nuts, chips, crunchy bread, you name it. Okay. So I've kind of laid off of it because I don't think it's worth it, although it makes me not very happy because my quality of life, I feel is not that great because I don't get to eat what I want.
Right, I can understand that. Okay. Well, a soft food diet is definitely some treatment that we, recommend, but usually over just a 2-week period. So we can go back to that later on after we do our exam, but that's kind of good that you're already doing that yourself. But hopefully we can get you to a point where you can have your crunchy bread and chips and stuff again. So let's go back to the stress in your life. So we established that. Is there any other event that you can think of, an injury or anything that could have caused it?
No, but I think the other thing that may be kind of stressful for me that recently happened is that I'm planning a wedding, and I have to deal with in-laws, and they're kind of annoying. So, yeah.
Okay.
Yeah, and I'm studying for boards now too. And yeah, that's just another added thing.
Okay, that makes sense. Well, when are you getting married?
In about 6 months.
Okay, so that's coming up quick. Yeah. That makes sense. That it's crunch time almost.
Yeah.
Okay. Well, and you said that you have headaches sometimes. So, do you take anything for that, or?
Yes, just, Tylenol, Advil, something over the counter for it.
Okay, all right, that makes sense. And have you ever talked to a physician about, the headaches or the pain that you've had?
No, just because I've been so busy with school that I haven't really had a chance to, slow down and, and just, a lot of things going on. So I haven't had a chance to actually come until, about now because our schedule isn't as bad. So here I am.
Okay, well, I'm glad you came in. So, yeah, you said that it was you've had the popping and clicking ever since you can remember, and then in the last 2 years, the pain started. So are you at a point where it was just so bad that you decided to see somebody for it?
Yeah, I mean, it wasn't as bad when school started, but I feel like it gets progressively worse.
Okay.
I mean, especially with stress. I mean, usually when I find that I can relax, then it usually helps. Like, it's not too bad. Pain is like almost not there, or like it's negligible.
Okay.
But, before exams, dealing with the in-laws, like when things don't go well, yeah, the pain is really exacerbated.
Okay, well that definitely makes sense. Well, okay, what I would like to do is take some radiographs and see kind of what's going on, and then I have a few other exams I'd like to run through to check out, your joints and your muscles and your teeth and how they're contributing to your symptoms. But from what you described to me, it sounds like you might benefit from some physical therapy sessions. So, I mean, this is a joint just like your knee is, and it has a lot of wear and tear, especially from somebody who likes to eat crunchy things, and, if you're really stressed out, those muscles are working overtime. So they have a lot of different techniques that could help you as far as like heat and ultrasonic and ionophoresis and a lot of things that will help relax those muscles and relieve the pain in the joints. So after the exam and everything, I have some names of some great physical therapists in the area, and hopefully we can get you set up for one of those, okay? Okay, great. Do you have any questions for me?
How long do the physical therapy sessions usually last?
Well, we can do anywhere from a couple, 2 times a week for a month, or we could do more sessions in a shorter amount of time. Basically, whatever kind of works in your schedule and whatever provides results for us.
Okay.
Okay, so I just have one more question for you. What would be your ultimate goal at the end of treatment? What would you like to see happen?
I'd really like to be able to sleep better at night. I'd really like to be able to continue eating what I like to eat.
Okay.
And I think the physical therapy would be a really good, way of managing my stress, just because, I have a lot of stuff going on, and I guess I need an outlet, or I need an outlet. So, physical therapy is just up there. I think it's a good idea.
Okay, great. I'm glad that we're on the same page. Okay, well, let's get started.
Okay, thanks.